Thanks everyone for joining us for this session tonight. Just by a quick, a quick little intro. I can see quite a few names in here that I recognize. So hi to all of the CPAC crew from last year who are joining us. It's great to see some familiar faces. For those who weren't in that cohort, who are on here tonight, um, Lauren Macdonald first joined the MMA team last year as she joined our faculty for CPAT, and she was out here facilitating the residential program with Ben Sessa. And I think I can comfortably speak for everyone at our team who was really amazed and impressed by her work, both as a teacher but also as a facilitator of those residential retreat programs. And we had everyone constantly asking for some opportunities to experience psilocybin overseas where it can be done legally, and constantly asking for an opportunity to do it with Lauren. And so we've had some conversations since then, and then she strongly said that Jen and Alalaho is the only real option that we have. And so that brings us here today to speak about this opportunity for everyone here to come and join us in July in the Netherlands with these two facilitating and leading a retreat over there. And so for this session, Jen and Lauren are going to speak a little bit about the work that they do, about what you can expect. We also have Rory, who's going to join us, who recently did a retreat, an Alalaho retreat with Lauren late last year. And then we'll have plenty of opportunity for questions and discussion and things like that. So you'll have plenty of chances to ask any questions that you have. So with that, I'll pass it over to you, Lauren and Jen.
Yeah, hi everyone. Really lovely to be here. And yeah, I can see a few familiar faces. So it's extra special to have you here. So I think, Jen, do you want to start off and kind of introduce Alalaho and yourself, and then I'll take over.
Oh, sure. Yeah, I can do that. So I was gonna say good morning, but yeah, good evening, everyone, because you're all on the other side of the world. I'm actually in France. So my name is Jennifer. I'm a founder of Alalaho, and I'll just share a little bit of the history of Alalaho. I won't take too much time because I think it's really important we have time for questions. But Alalaho basically started a good few years ago. It was in 2016. And at the time, we were actually the first team to go to Holland and facilitate these legal psychedelic journeys. So it was pretty pioneering. We were the first organization. We were at the time part of the UK Psychedelic Society, and known as the Experience Retreats team. And it really started as just a group of friends with their own experience of personal transformation, working with medicine, psychedelics, putting on these weekends. And of course, with the years and the kind of maturing of the project, the offering really evolved. So we started doing a lot more integration work, a lot more preparation, and came to basically offer what we offer today, which is a 4-day or a 5-day program with preparation before the retreat, on the retreat itself. There's also integration similarly on the retreat and afterwards. And I would say something that I think is incredibly special about Alalaho is that our team has actually been working together ever since the very start of this project. And the kind of cohesiveness and warmth that it creates in the field is something that our participants are always kind of sort of incredibly touched by. Like, there's something just so friendly, so warm, so welcoming, also quite playful and, you know, kind of humorous about the container that we create, all the while, of course, taking this work incredibly seriously. And another sort of little, I would say, kind of specificity of Alalaho and our team is that everyone on the team brings a mixture of both training in kind of Western clinical psychotherapeutic modalities, but also a real wealth of experience in different spiritual traditions. So, for example, for myself, I've been practicing in the Tibetan Buddhist tradition for more than 15 years. We have a lot of team members that have been very deeply immersed in the kind of shamanic traditions of the Americas. So there's that kind of real sort of mixture of psychological and kind of spiritual approaches without, of course, any kind of, how to put it, there's nothing dogmatic, you know, we don't force people to be spiritual. There's no particular language that people have to use. There's just that kind of openness to exploring whatever psychedelics might bring up for participants, which tends to always be a mixture of very personal, therapeutic kind of insights, and sometimes things that have more to do with the nature of reality, the nature of the universe, and where having these different approaches can be incredibly useful. I think that's kind of it for Alalaho. I'll pause here and head over to Lauren. I'm sure she's got some interesting things to add.
Thank you, Jen. Yeah, I knew you'd be able to just kind of sum it up really succinctly, and also pronounce the name, which I still struggle with sometimes. Yeah, so I guess the reason I wanted to kind of bring MMA and Alalaho together really comes because on the CPAT residentials, which as Scott said, I was kind of leading, lots of people interested not only in my clinical work, which for those of you who don't know me, I've been working at the Centre for Psychedelic Research at Imperial College London for the last 2 years, working on the trials there. And whilst lots of people were very interested in that work, there was also a real interest in the retreat work, the group work that I've been involved with. And I've worked for a few different organisations now in the Netherlands. And for me, Alalaho just stands out by far, just like as a really heart-led organisation with such integrity. And I have an extra sweet spot for Alalaho because it was actually the first retreat that I ever did. So as somebody who was completely psychedelic naive 5 years ago, when kind of psychedelics came onto my radar and I really wanted to incorporate them into my psychiatry work, I realized that I needed to go and have my own experience, or at least I felt like I wanted to go and have my own experience for 2 reasons, really. One, for my own healing journey, just to continue on the path of healing and personal development, but also to become a psychedelic therapist, I felt I needed to go and have the experience and to really understand and to do it in a way that was safe and held. So in 2018, I went off to the Netherlands and joined an Alalaho retreat, what was formerly called the Psychedelic Society, I think, and had such a profound, incredible experience that it really has changed the course of my life, of my career. And I will just forever be grateful for the team, the holding, the whole experience. And it was actually really sweet. In December, I was in the Netherlands facilitating for Alalaho, and one of the facilitators I was working with, he actually facilitated the first retreat that I went on as a participant. And we were just kind of reminiscing about what a journey I've been on in the last 5 years, from coming as a participant to now, working on the clinical trials and the retreats, and just kind of where my career's gone as a result, but also where I've gone, how transformative and healing it's been for me. So yeah, I just love Alalaho. I love the whole team. And I remember the first time when I went on the retreat as a participant, I said to one of the facilitators at the end of the retreat that actually it was such a transformative experience, like the whole 5 days, that even if you took out the psilocybin truffle ceremony, I would have still experienced huge shifts. And I was so aware that it had been so helpful for me to be in the group. I don't think at that point I realized just how much like groups are medicine, and increasingly kind of being in the psychedelic space and seeing it all unfold and issues of affordability and accessibility. I'm increasingly just thinking the group model is coming and will be coming at some point. It already is in certain places, Canada, America. There's already clinics running groups, psilocybin ceremonies as part of their prep and integration programs. So I feel like as practitioners as well, if you're kind of wanting to work in this space, maybe you will end up working in a clinical environment, with 2 therapy guides, 1 patient, but potentially down the line, you will actually maybe be also facilitating groups. Because that's the only way I can see it's going to be affordable for more people. So I think as well, just having the experience of being in the group, seeing what that's like to sit in sharing circles and go through a group process. Personally, I think obviously it's not for everybody, but there's something in the group that, and I can't even put it into words, how potent it is, how healing it is, how supportive it is, and that community that continues as well beyond the retreat. It's not just the retreat, it does continue through WhatsApp and Signal groups, and there's just a really supportive container that's created and then carries on that thread. So yeah, as you can tell, I'm very passionate about Alalaho and the groups and the retreats, and we are really lucky tonight to be joined by Rory, who I have just seen pop up on my screen. And Rory was actually a participant at the Alalaho retreat that I was facilitating in December. And when we arranged to have this webinar, yeah, I just thought it'd be so nice if Rory could join us because he's Australian as well. So I know a lot of you are probably thinking, do I fly all the way to the Netherlands? Like, is this something that's worth my while? How was it to do that with jet lag and all of these things? So yeah, Rory's very kindly agreed to come and join us. So yeah, I don't know if you're happy now, Rory, to take over a little bit, but it would just be great to hear a bit about your experience in December, how you found the Alalaho retreat, how you found the travel as well. Yeah, it'd be lovely. Don't know if you can unmute yourself there, Rory.
Sorry, I should be used to that by now. 4 years I've been using Zooms for everything. I still forget to unmute. Thanks everybody, and thanks Lauren. It was absolutely wonderful to be part of the group that you led, facilitated. I don't know what the proper terminology is, but it was really great to have you and the other facilitators there. I was completely impressed by the level of professionalism and care, compassion, and empathy displayed by the facilitators. It made me feel very comfortable upon arrival at the facility. I don't know if that's the proper term, but and just to go to the jet lag issue, it wasn't a concern. I have always found it's when traveling to Europe, there's no real problem with jet lag. The jet lag always hits when you come the other way on your return journey. So there's no problem keeping up once you get to the Netherlands. And I think that the experience was amazing. I mean, all of the briefings beforehand, the integration afterwards, made the experience even more wonderful. Certainly, it was everything I hoped for. I've been quite an anxious person. I still am a little bit, I guess, but that's primarily why I decided to go to Holland to participate in the process to deal with that. The experience, so there was all a lead up sort of group work that we did where we got to know each other, began to empathize with each other, build relationships for the day before the ceremony. And on the day of the ceremony, it was very, very, very well done. You know, I can't compare what goes on in other places because I haven't done it, but I was completely impressed by the organisation, the professionalism, etc. But the experience itself, I think, as Lauren said, and I have heard and read from other people, it is life changing. I think it is for me, at least. It's helped me explore some of the difficulties I've had in my life. Helped me reconcile with difficult relationships I've had in the past and difficult experiences, and start a new day. I think, you know, it's I don't take those things into account anymore. It's given me the space to be able to deal with things on face value, approach people with more trust, and perhaps compassion, and take things a bit easier, I think. Right? But the experience itself, while I was deep in that, I don't think is anything to be nervous about in any way. Everybody that I spoke to afterwards has their own interpretation of the experience, but what the commonality in discussions is that while it can be quite intense, it's important for participants to surrender to the experience, to let the experience itself guide you, and then once you are in the experience and I guess dealing with that, then you can start to decide what you want to deal with while you are in the experience. You know, it's a combination of the experience guiding you and you trying to, I guess, be a pilot in the experience as well. Either way, it takes you to, I think, the place you need to go to deal with those situations. Do you think there's anything else I need to add? I mean, it's very well organised. I think, you know, the nuts and bolts around it is something you have to work out for yourselves. You know, what flight you're on, where you stay, you get to the shop, you get escorted onto the bus. It's all very, very well organised. You don't have to find your own way to the venue. That's the proper word, isn't it? The venue. And it's completely professionally run. I would have no hesitation in recommending Alalaho. I can say it. I think to anybody, and I did lots and lots of research on the different programs, on the different organisations before I settled on Alalaho, because of you know, the interviews before the experience, the integration calls afterwards, the reading material that's provided to people, you know, is I can't fault it, you know, and for anybody who hasn't had a psychedelic experience before, I think you can have every confidence in the way things are done at Alalaho. I was very impressed. I am still feeling the effects from the experience. I will say my landing wasn't too good because I had a pretty bad chest infection from my travel back to Australia, so I had to deal with that. But I can still feel, what is it now, 6 weeks after the events, something like that. I can still feel the effects of the experience, in that it is easier for me to deal with people that I may not have the best relationship with. I have a more trusting approach, and it gives me moments where before I may have been just behaving in a reactive way, but somehow this has created a space in my mind where I can think before I react, and what I am teaching myself to do, to think, is to react in a better way, to be more considerate. And because the work I do is fairly intense, shall I say, where I'm dealing with a lot of interpersonal conflict, etc. Look, I'm a lead union official. I'll put that out there. Right, so I'm dealing with tense stuff all the time, and I guess became set in my ways. That is now changing, and I'm very pleased to do that. And in fact, what I am now considering is perhaps doing some therapy courses so that I can perhaps get involved in providing therapy or leadership for people who may need it. I think I'm not sure if you think there's anything else I could add about the experience, either Lauren or Jennifer, or perhaps Scott.
I think that's amazing. Thank you so much for sharing, Rory. It's really helpful to hear, and I'm just really pleased to hear it's still unfolding for you, and yeah, you're still getting the benefits 6 weeks later.
Thanks for that, Lauren, and as I say, thanks for your loving presence at the retreat.
Thank you, Rory. So should we maybe, I don't know if we should open up for questions, or Jen, is there anything else maybe you want to add about the program, the flow of the Alalaho experience?
Happy to take questions. I'm sure the questions will kind of get us everywhere that we need to get to. Yeah. And thank you so much, Rory. I've heard a lot about you since the December retreat, and it's yeah, thanks a lot for coming here to share your experience. Really.
Thank you.
And so perhaps before we open right up for questions, one thing maybe to just introduce a little bit first. It may come up in questions regardless. With these retreats, there is a slight difference, I guess, in terms of what we're doing as opposed to the regular Alalaho retreats, because these retreats do have a bit of a training focus as well. And so I'm not sure, Lauren, if you want to make any comments. Maybe actually I can even to begin, in terms of from some of the conversations and the idea with this, of what we're aiming to do here is to merge some of the ideas that CPAT students will be aware of and what you've learned with what Alalaho has been doing, to bring this experiential component together. And it's something with, I guess we do have the CPAT graduates in mind in one sense, but it's also something that we very much feel is aiming to be relevant for practitioners at any stage of their journey. So even if they haven't undergone any training in psychedelic therapy yet, as something where there's an opportunity for this experiential component, this experiential training, almost to start the journey, as well as to be placed anywhere else along it. And I'm not sure if Lauren or Jen, if you have anything further you want to sort of, I guess, just expand on that element of it.
Jen, are you going to jump in?
I can do it. I'll start with something because that's coming to mind, about this training, and it's making me think about the Alalaho team in itself, actually, and how we came to doing this work. So basically, the idea Scott was saying is to really weave in some kind of training components as we go through the retreats. There's something, it's going to be done in a very gentle way, because really the main focus is still on everyone having a full experience of these kind of retreats. And you'll see that, having a ceremony like brings up a lot of personal material. So it's not going to be like, it's not going to be, kind of like a very, like teaching a class. But what we want to do is to really help you make the most out of being in this kind of container, so that you can, as we go through the steps, harvest the kind of learning from the experience while it's fresh. And people often ask me, oh, what training should we do? Like, we want to be psychedelic facilitators. And I always give them the same answer. It's like, of course, if there's a training you want to do and that would help you get the foundations and some blocks in place, it's wonderful. By all means, go for it. But it's not the only way. And actually, nobody on the Alalaho team has done a psychedelic facilitator training per se. But what we've all done is had, kind of extensive experience ourselves, like going to ceremonies, working with these medicines in different contexts, different environments. We've done therapeutic trainings, trained in other kind of modalities and practices. And through that, we've kind of learned not just how to facilitate a psychedelic ceremony, but actually how to accompany people through their kind of inner landscapes with all that comes with, and psychedelics being just one modality. But so in terms of the kind of training component, like, we will have some sessions where we'll really kind of go in and dissect, like, and look at, okay, how do you create a safe container? How do you hold people? How do you use touch in ceremony? Like, what's appropriate, what's useful, and really actually help you extract from your own experiences and from that of the group, which is incredibly rich, what the kind of, key essential points are, if that makes sense. Yeah, over to you, Lauren.
Yeah, I think it's finding that fine balance when you kind of weave together the training elements with the kind of personal process as well. It's very much the retreat is for your personal process first and foremost, and then there will be training elements kind of brought in, not so heavily that it becomes, a deep immersive training by any means, but just like Jen said, chances to reflect, to kind of see what was helpful. How do you create a safe space? How do you really feel safe? And it's a chance to not only know it on an intellectual level, but to really experience it and to feel it. And I think that just is really just like a deepening of your training in itself, to actually know in your own system, in your own body, what it feels like to be held in that way, to be supported in that way. And I think, like, to Scott's point about where in your training should this experiential come, as I said, I actually came on a retreat. The first thing I did was went to a retreat as a participant myself, and that kind of kick-started my training and everything I've done in the psychedelic space over the last 5 years. But equally, I can see it being really helpful maybe midway through your training or at the end of your training. I think for me, it's just like it needs to be there. And I know there's a big discussion in the kind of psychedelic space about, do psychedelic therapists need to have experienced an altered state of consciousness? Do they need to have experienced psychedelics? And I've kind of swung like both ways. For a while, I was working with an amazing therapist on the clinical trials at Imperial, and she'd never taken a psychedelic, and yet she was one of the most amazing co-therapists I've worked with. So I feel like I used to say, yes, if you're going to be a psychedelic therapist, you need to have had this experience, you need to understand the terrain. Having worked with her, she definitely has made me kind of question that a little bit. But I do think in terms of really kind of, like I said, not just intellectualizing the knowledge about how you hold space safely, how you use touch appropriately, but to actually experience it yourself. That's why I'm really passionate about this, kind of going off on your own experience. And also, I think as guides, we have a responsibility to carry on doing our own inner work as well. It's really important to kind of have a peek at our shadow and carry on, just really looking at ourselves so that we can be the best guides possible as well. So it's for many reasons, I think, that the kind of marrying up of the personal process, personal experience, and then some training elements is really helpful.
Amazing, thanks. And so what we might do is open up for questions. And what we could do is, if anyone has questions, if you'd like to, you can use the hand up feature and then ask them yourself. Otherwise, if anyone would prefer to, you can also pop them in the chat.
And just to say, Rory's hanging around for a little while as well. So if anyone has questions for Rory, please also add those.
And so there's the first question that's coming here from Brett. How does the retreat therapy differ from a clinical trial or commercial providers in relation to pre-dosing, dosing, post-dosing, integration, and cost?
I mean, that's a big question. Shall I start? I'll try and answer it succinctly. So essentially, to be really clear, it's not retreat therapy. It's all retreats won't publicize themselves as being therapy as such. They're more personal development retreats, spiritual development retreats, and obviously some people will come with anxiety, depression, but the screening process is really thorough on the retreats, very much like on the clinical trials. And again, I can only really speak to Alalaho and a few of the other retreat organizations I've worked for, but in terms of preparation, it's really thorough as well. So that it definitely does follow the same kind of arc as the clinical setting, in that you have the preparation, you have the dosing, or we call it the ceremony day, and then you have the integration follow-up as well. And cost-wise, I think I can't really answer that so clearly, just because at the moment we're just gauging how much the cost is going to be for people to have psychedelic therapy in the clinical setting. And the retreats are obviously much cheaper compared to that. I don't know, Jen, if you have more to add.
No, nothing to add, no.
I might pass it on to Stephen.
Hello, beautiful people. Great to see you.
Hi, Steve. Nice to see you.
You're looking very angelic. And after this, please send me a blessing for, I need spiritual protection for next week. So send me a blessing, please. All right. Oh, now, I've got a practical question. When we arrive in Amsterdam, do we find our own way to the shop on a specific day, or does the bus leave the shop every day? And is there a bus that takes us to the retreat? And are there single rooms in the retreat? And also, can I get a certificate after the retreat that says that I've been someone with lived experience who's had the preparation, dosing, and integration? It may help me in my application in Australia to become an authorized prescriber. So.
Cool. Thank you for that question. I can take that one. So on the practical side of things, everything is organized so that basically the group meets together at the local kind of smart shop. It's right next to Amsterdam Central Station. The smart shop is called Kokopelli. It's a really beautiful smart shop. It's kind of an experience in itself visiting it. So the group meets there at a set time. We send all the information about all of these kind of practical things in writing once you've gone through the kind of screening call. So the group meets at the shop. There's one of the staff member that knows to wait for the whole group, like sells you the truffles. For licensing reasons, we can't sell them ourselves. So that's why you have to go to the smart shop. And then the person from the shop escorts the whole group to the bus. It's just a 2-minute walk. and everybody gets on the bus together and comes to the venue where the team is waiting. So everything's kind of coordinated and done together as a group. And your second question about the certificate, that's not something that we currently have in place. It's maybe something that we could discuss with Scott and Mind Medicine Australia to see how that could work out. Yeah, if Scott, you have anything to add on that?
Yeah, I feel that that's something that we can definitely arrange. I feel, oh well, especially as this does have a training element, so to have a sort of certificate of attendance type thing. And yeah, we can work to make it something that can help to support it. I do know of some of these challenges, Steve. We should have a chat soon as well about ways to support you with that element of the AP application as well, because there's a few different things that we're working on at the moment as well to try and support people in your situation going through the application process at the moment.
Okay, good. Thanks.
Yeah,
Thanks.
did that answer your question also? Yeah, for the practical things.
Yes, and the bus takes us back to the smart shop at the end of the retreat.
So the bus takes you back to the airport at the end of the retreat, straight to Schiphol Airport, actually. And you also asked actually about private rooms. So there are a limited number of private rooms available at the moment. If I'm not mistaken, I'm not 100% sure, but because we already have some people signed up, and I have a feeling that the private rooms might already be taken up for the July retreat. But yeah, to be checked.
Okay.
Great. Thanks, Steve. I might grab this one from the chat next, and then we'll go to you after that, David. So first, Edna's just asked how many people is recommended to have in a retreat, and how many guides, therapists per person?
Shall I take that, Lauren? So we usually have a group of 16 participants with 4 facilitators. So there's a 1-to-4 ratio. And yeah, maybe something on the group size, like we've kind of worked with different size groups over the years, and there's something about that number that's always felt really, really great, in the sense that there's a real sense of being a group, being a community. There's a lot of richness that's bring from, you know, having just different life stories, different people in the room, in the space. But it's also small enough that it really feels like one group. You know, it's like by the end of the retreat, everybody knows each other, and there's just that sense of being kind of one entity. I think when you start going a bit more up with the numbers, it can kind of break into like smaller subgroups. But yeah, 16 is usually really, really lovely.
Thanks, Jen. David.
Yeah, hi everyone. I was just wondering. I just moved to Holland actually from Netherlands about a month ago. So I'm Australian and have been following Mind Medicine for quite some time. So I'm thinking about doing a certificate over here. I think it's from Synthesis, I believe, and so I can see that because things are a little more relaxed here than in Australia, that perhaps a retreat such as the one we're talking about, which does give some support or some learnings regarding the training practitioner sort of side of things. For me, that's probably potentially more valuable. But in Australia, if you go back to Australia and it's kind of hard to do this kind of work, then of what benefit is it for people to train if they can't really apply it? Is it, or am I mistaken about the ability for people to do this kind of work in Australia at the moment?
So the regulations have just sort of been going through a process of changing. So the first patients to receive MDMA in clinical settings in Australia both received dosing last week. There were 2 patients that received it. And so this is sort of a field that's opening up, like sort of currently in Australia. And I think we're going to see over the next few months, we'll see this sort of program starting to pick up pace. So I think that's one of the reasons why we're starting sort of seeing lots of movement.
Yeah, because I guess I'm curious because I understand that a lot of the benefits or the legit or legally accepted sort of benefits and the kind of practitioner side of things has to be in a legal sort of format. So you should probably be a psychiatrist or a psychologist. But I guess I'm curious about the path through to being able to provide support or some kind of help to people without those kind of qualifications. So I'm just trying to see that pathway at the moment. If you're not a psychiatrist, you're not a psychologist, then where does this journey take you to? If you do wish to still do work with people, but you don't have that degree, then what's the limit of what you can do, or how can you participate in the field if you don't have a degree in that kind of thing?
So yeah, so in Australia, because it is something that we're seeing, use of these within the medical system. So without a background working within healthcare, then it is much more restricted. Whereas in somewhere like the Netherlands, because of the nature of the regulations around psilocybin truffles, there is a bit more flexibility, I suppose, there for people who don't have a background in healthcare to be able to do work work in that space. So the differences in regulatory environments.
Yep. Okay, thanks.
No worries at all. Another question that's just come up in the chat here is whether the July training, the retreat, the only one offered and planned at present? It is the only one we have planned in at the moment. So we have this one in the calendar as our first and sort of pilot program, and then we'll see over the next few months, over the next little period, of what plans are in terms of putting any others in the schedule. And do we have any other questions or any other comments from anyone in the audience? Yes, Anna.
Hi, everyone. I have a question that I forgot actually ask at the CPAT as well. And this comes to me only because I am Polish, so my first language is not English. And I also work with people in altered state, and I have many Polish patients myself. And when they are in trance, they prefer speak Polish. Do you have any experiences with that? And what do you do then?
That's an interesting question. It kind of resonates with me personally, because I had that for years, that when I would myself, so I'm French, my mother tongue is French, and when I would take psychedelic medicines, I found it so hard to speak in English. There was just I don't know exactly what happens in the brain, but there's just that kind of extra comfort in speaking in your own kind of mother tongue. I mean, if these people want to speak Polish and you're able to meet them in that way, I think it's wonderful, and by all means go for it. It's I think the more ease we can create when people are in the ceremony, like under the kind of influence of the medicines, the more ease the better. Usually the other thing is that it can be, and that's where it differs quite a lot from MDMA. I think psychedelics are particularly non-verbal. Like you'll see when I think in the ceremony, there might be, of course the language is still there, but it's your mind is expanded in such a way that language is kind of almost inadequate at that point. So the ceremonies that we do, certainly in a group, are like mostly silent. We don't do, like, say, a kind of full-blown therapy session during the ceremony talking about someone for hours. We just really let them be immersed in their experience, and then we'll process it afterwards. Yeah. Don't know if that answers or kind of speaks to what you were getting to.
No, I think that answers my question. Yeah. Like, but it's not usual that you ask about first language, because especially in with psilocybin, it's not necessary. Like you said, MDMA is more like talkative therapy session.
I can jump in as well if that's helpful. I'm actually thinking of a particular clinical trial participant that we with psilocybin therapy, and we during prep we just really welcomed her to kind of vocalize in her mother tongue during the session, and just to really invite that. And even though we wouldn't have understood it, like the invitation was there, like it's totally welcome, whatever vocalization or whatever needed to be kind of shared into the space. And I think just that invitation itself is really helpful. Like, you know, Jen was just saying, actually just trusting however you need to express, but that it might also be non-verbal as well.
Yeah.
Can I just add from the experience I had in December? We had two participants whose mother tongues weren't English. One spoke Portuguese, another one an Asian language, and they were perfectly fine speaking in English during their experiences. So I guess it must be different experiences for different people, but you know they were certainly whenever they expressed themselves, they were speaking in English.
Thank you.
I guess just to jump in as well, and I was aware, Jen, when you said, "Oh, the retreats are in silence," and then I suddenly thought, "No, there's amazing music." But I think you were talking specifically about if there's talk therapy going on during. So I just wanted to clarify that it's not a totally silent space, and if anything, it's actually quite often not completely silent.
Yeah. Thank you. I meant no kind of extensive talking, no talking between the participants, and very minimal with the facilitators. Thanks, Lauren, for picking that
up. We have another question in here from Brett, which is just maybe a little bit more information about the format of the retreat after buying the truffles, but through the 4 or 5 days.
Yeah. Sure. Yeah, I can give you a little kind of a little tour of the program. So in a way, actually, I'll just start a little bit before the truffle. So there is some preparation that happens actually in the lead up to the retreat. So we send some preparation material from the moment that you're accepted onto the program, some kind of things to read, things to watch, to just kind of get your head in the zone a little bit. And then in the month leading up to the retreat itself, we start getting a bit more, let's say, experiential. So we send some preparation kind of exercises and preparation tips for you to start dropping kind of deeper in yourself and in your process. And then, yeah, from the moment that you arrive on the retreat, you'll have around 24 hours of preparation work. Now that will involve some group exercises just to get people to kind of open up and connect with each other so that it feels by the time the ceremony starts that there's a real kind of bond and warmth in the group. So there's group exercises, there's also kind of morning practice. It's always a mixture of mindfulness, meditation, some somatic kind of more embodied exercises. Especially as we'll know that all of you, will have been on like really long flights. So we'll get your bodies a bit more kind of relaxed before the ceremony. And there's also one-on-one with the facilitators. There's a bit of solo time that's also built in. And we also have like quite a thorough kind of preparation session that we call the flight instructions, where we really talk about the ceremony, how it all unfolds, how it happens, give you tips on like how to navigate the experience so that you feel really kind of equipped and empowered going into the ceremony. So yeah, 24 hours of prep. Then you have the ceremony itself, which is in the afternoon, goes until the evening. There's then like just a very kind of silent, quiet evening as people are still kind of very much processing what came up in the ceremony, just still with the effects of the truffles. And after the ceremony, we'll have 2.5 days of integration. And I won't tell you exactly what we do because it's nice to keep like some element of kind of surprise and unknown, but it's basically the same sort of formula, so to speak, as with the preparation. So there's always like morning practice, there's some group exercises, group sharings, one-on-one again with your facilitator, and also some solo time built in. And we'll also, as we've kind of discussed, like be weaving in some kind of training, reflection kind of sessions to really, just harvest all that kind of wisdom from the ceremony, also from a facilitation or kind of guiding point of view. So 2 days of integration, and then the last morning, really that last half day is sort of talking about integration, preparing you for your travel back home and what's to come, preparing you for that kind of integration journey. And after the retreat, we'll be meeting on Zoom 3 times in the kind of 3 to 4 weeks following the retreat to support you with the integration.
Amazing. Thanks, Jen. Stephen.
Yeah, for July, who are the 4 facilitators? Is it Lauren and Jenny, and who are the other 2? And then if some people have already booked, how many places are still available?
Mm-hmm. So the 2 other facilitators, I'm fairly certain will be Jamie Richards and Jonah Brody. They're 2 of our most senior and experienced facilitators. I mean, they're also actually leads. So you'll have like four leads essentially on that retreat. You've got a really, really solid team. Quite extensive also, yeah, kind of training in psychotherapeutic modalities. So yeah, it's a wonderful team. I would say that the team's wonderful with any constellation of our facilitators, but this is going to be a really wonderful team. And in terms of number of places available, I think we have about 5 or 6 bookings at this stage. So there's probably a good 10 places left.
Okay.
Yeah, and I can just jump in and say that Jonah facilitated my first ever retreat, and then it was Jonah who I was facilitating with in December. So Rory got to meet him as well, and he's a wonderful lead, really special. So it's going to be a great team.
Okay.
Thanks, Stephen. And David.
I can't recall, I can't seem to find the details now, but was the package that flights are included, or is that you just book your flight separately?
You book flights separately.
Okay, cool. Because I won't need flights because I'm already here. And also just a logistical thing. I would really like to come to this event, but I live in Utrecht, which is not too far from Amsterdam. But I have a 9-year-old son, and I'm trying to work out how I could possibly spend, 5 days, or find care for him or whatever. Is it at all possible to be residential for, say, the first couple of days and then just come back each day for the remaining 3 for the integration part of it? Like I can see the value in being there the whole time, right? I've done this before, but I'm just trying to work out how it could be done, practically speaking. Do you think that could be, is there any flexibility there, or does it, you have to be there without leaving for the whole 5 days?
I would say you have to be there for a number of reasons, and I know it's often quite a big thing, logistically for parents to leave the kids behind for like 5 days. But so first of all, it's like every single part of the program builds on the previous one, leads to the next one, and has like a very kind of significant role to play in the overall journey. So we wouldn't want you missing any part. And we also have activities in the evening, actually. And the other thing, to be honest, is that there's something also like to do with almost with kind of safety. Let's say like even just psychological and emotional safety. It's like you will most likely be cracked open by the ceremony, and you never know what it's going to be afterwards. Like sometimes people experience a lot of grief, just a lot of emotions, are really open, really sensitive, really tender. It can also be really joyful, but even in that joy, there's a real rawness and tenderness. And we just would not want you like getting back on trains, like trying to travel back home or driving your car, having to like take care of someone else when actually really most likely you need kind of support and taken care of. So yeah, just for kind of integrity reason, we wouldn't want you sort of breaking out of the container and then back in, and also would affect the group. So yeah, it's not really possible.
Okay, I was just because I was a single parent, but yeah, I totally understand that. I thought that was what you would say, and I would probably feel uncomfortable disrupting the group and myself at any point of it. When I said I've done this sort of thing before, so yeah, I can see the value in in not corrupting or compromising the flow. Yep, thanks.
Yeah, we can support you. So that's also part of what's communicated after the screening process. Like we really invite people to also switch off their phones generally for the whole duration of the retreat, just to be kind of free of distraction, really present with their process, with the group. But for example, that's where we could, of course, support you and, you know, be flexible. Like if there's something like you checking in with your son like every day on the phone, we could, you know, make sure like to help you find the right moment to do so, like these kind of things. But yeah, we'd have to kind of still keep you in the container. Yeah.
Great, thank you. I'm wary we're getting close to 8. And possibly just to wrap us up in terms of just like practical details for anyone who is wanting considering joining the retreat. The best way to get all of the information about this and to apply, we've just made some updates on the MMA website. I did this over the last couple of days to make it really clear, and I'll pop the link in there. And if you go to this page on the website or go to the MMA website and look at training retreats under there, there's a page which has all the information about the retreats and it has a link through as well to the application page on Alalaho's website. So if anyone is wanting to join, you can go through there to then book a screening call, which will be with Jen or a member of her team. And then that's how you can take the steps forward to joining the group in July.
Yeah, if I can just add exactly like the screening call is of course about us finding out what we need to find out to make sure that the experience is safe for you, but it's also a space where you can ask questions. So yeah, all the questions that we might not have had time to answer today, like there's other chances. And also if need be, you can ping me an email and I'm happy to answer any questions.
And so Lauren or Jen, do you have any sort of final questions or comments before we wrap up?
I don't think so. I think that was a bit of a whistle-stop tour, but yeah, hopefully you get a sense of yeah, the experience and Alalaho, and yeah, I just really hope that you can join us. It's a really, really amazing experience, and obviously it's a huge experience. It's not something to kind of do lightly, but yeah, if you say yes, I can guarantee it will be transformative. Yeah.
Yeah, just echoing that, really, it is a magical experience. I often find it really hard to put into words quite how magical it ends up feeling for people. And it's the psychedelics are in a way like a very small part of it. There's just the feeling is almost something about almost remembering what it's like to be human, to be connected, to be grounded, to be open. Like there's just so much that happens within the space of 4 or 5 days. It's quite mind-blowing, really. So yeah, hoping to meet some of you on board. Yeah.
Amazing. Thanks so much, Jen and Lauren. Thank you, Rory, as well. And to all of you for joining us for this first retreat. If everything goes to plan, I'm also hoping to come over for it. And so I hope to see some of you over there as well. It's been a pleasure. And if you have any further questions, as Jen mentioned, you can get in touch with her. You can also reach out to our team or to me directly, scott@mindmedicineaustralia.org. Yeah, looking forward to seeing some of you in the Netherlands in a couple of months.